And you're live.
Hello, good evening. I'm Glenn Sanderson, leader of Northumberland County Council, and welcome to our first COVID public health question time. We wanted to use this to offer some reassurances and to possibly offer some help as well. Every day, the County Council receive hundreds of calls and contacts through the contact centre, the website and social media, and many of those have been around COVID. Now, some of the questions that you put to us, we may not be able to cover tonight, but we will try and get back to you if we can later on. This has been and is a very tough time for all of us, each and every one of us, on our families, on our businesses, and on our homes and the way we are used to enjoying our lives. I want to say straight away how proud I am of our County Council staff, those frontline services that have kept going, and all the work that we do in and out of the communities helping people. I hope tonight that we will be able to answer some of the questions and some of the thoughts that you may be having, and I hope this is of comfort to you if you are unsure about where we are going with this difficult and very horrid virus. So tonight I'm joined by our Director of Public Health, Liz Morgan, and with our Chief Executive of the County Council, Daljit Lally. So Daljit, over to you.
Thank you, Glenn. Good evening, everybody. My name is Daljit Lally and I am the Chief Executive here at County Council. I work in a joint role with Northumbria NHS Healthcare Trust. I have for many years worked in the health and social care sector, originally training as a nurse. It's great to be able to speak to you this evening. I am very grateful to those of you who have taken the time to join us here tonight or to submit a question. Firstly, I want to thank everyone in Northumberland for all the hard work so far. I know it hasn't been easy and that for many of you, this pandemic has required you to make enormous sacrifices, often at a considerable personal cost. However, as you're probably aware, we are now at a really crucial point, and it's incredibly important that we make sure all of our efforts don't go to waste. Whilst this national lockdown does feel like a very different one to the first one, we must still take the virus very seriously, or we risk together tougher measures continuing, and the likelihood of us returning to anything that resembles normality may well be slim. But I would just like to say, together we have the opportunity to make a difference. Thank you.
Thank you very much, Daljit. Over to you, Liz.
Thanks, Glenn. So for those of you who don't know me, I'm Liz Morgan and I'm the Director of Public Health for Northumberland. Obviously, we don't want to come out of lockdown with higher case numbers than we went in. And if we all follow the rules, those really basic prevention measures which stop infection from being passed on, then every single one of us can make a difference. I'd just like to finish this introduction by showing you the latest statistics for Northumberland. So this is a view of our public-facing dashboard, and this is what the dashboard looked like in the last week of October. So that's the 20th to the 26th of October. So you can see from this graphic that we had 579 cases in that week. And when you look at the map in the bottom left-hand corner, there are quite a few places in Northumberland where we've had very few cases. And those orange sort of dark brown areas are the areas where we had more case numbers, and not unexpectedly, in areas where we have more people, we have more cases. The graph on the right-hand side looks at the number of cases over time. So these are the number of cases that we've seen in Northumberland since the pandemic started at the beginning of March, or certainly since we started recording case numbers. And you can see that from the end of June until the middle of August, the number of cases was really low. We were having sort of just literally a handful a week. But from the middle of August, cases started to increase. And certainly from the second week in September, we had a real escalation in cases within the county. But that rate of increase leveled out towards the end of September. And from the end of September until the end of October, cases had really started to plateau. But when we look at the picture now, and the next infographic, we'll be looking at cases for our most recent week. So this is from the 9th to the 16th of November. You can see that we're now getting 899 cases a week. So that's a 56% increase on the number of cases that we were having 3 weeks ago. And when you look at that map in the left-hand corner, you can see that there are hardly any areas of Northumberland which have had just 0 to 4 cases. There are more areas which have had higher numbers of cases. And then when you look at the graph on the right-hand side, you can see there the plateau that I talked about before, but you can also see that cases really escalated from the end of October, beginning of November, peaking at 168 cases on the 9th of November. Now, what we're really concerned about is older people, because age is the biggest risk factor in terms of the harmful consequences of coronavirus. And this graph here looks at the average number of cases over a 7-day period in various age bands. Now, the age band at the top, which is the sort of purpley grey one, is people under the age of 25. And you can see that that really escalated quite rapidly at the end of September, beginning of October, and then it also dropped off quite rapidly. And we're attributing that to the national outbreak in university students, because when we burrow into that data in a bit more detail, we see that actually most of those cases are in people aged 18, 19, 20. But for all of those other age groups, although there was a bit of plateauing in some ages, and obviously a decrease in that under 25 age band, what we've seen over the last week or couple of weeks is that cases are starting to increase again, and more concerning, cases are starting to increase in that older age group who are the most vulnerable. So from a northeast perspective, we've still got the lowest case rates. We've still got the lowest proportion of tests coming back as positive. And we do have relatively high testing rates. But in England, we are in the top third of local authorities in terms of case rates. And the picture that we're seeing in Northumberland is one that is very much mirrored in most other local authorities in the northeast. As I said at the start, you know, if we all follow the rules together, we can protect ourselves, our loved ones, our friends, and particularly those residents in our towns and villages who are at greatest risk from this virus.
Super. Thank you very much, Liz. Let's just go into questions now. The first question, I think for Liz, many residents, including Chris from Ashington, has said, please can you explain why the figures are so high? Is the national lockdown not working? And are people just fed up now? What are the reasons behind it?
So I think residents across Northumberland, and in fact the whole of the North East, have followed the guidance on a range of changing regulations for most of the year. And you know, it's been a fantastic effort, because infection rates did level off, which they didn't in any other area after the restrictions were put in place in the middle of September. And those restrictions basically sort of morphed into the high COVID alert level that we had before the onset of lockdown. but we've been really clear throughout this pandemic that case numbers can increase in an incredibly short period of time. And, you know, we saw that in the middle of September. And although we have had some outbreaks in a number of settings, and they have contributed to the increase a little bit, it's possible that what we're seeing is a result of many of us just not following those basic rules quite as well as we had been. And that might be on the back of half term, it might be on the back of the announcements about the lockdown being imposed, or even the prospect of a coronavirus vaccine. I think as well that people are really suffering from pandemic fatigue. They're absolutely fed up with having restrictions imposed and losing control over their lives. So over a period of time, people just start to push against the boundaries. And I think one of our biggest challenges is going to be motivating, re-energizing and refocusing our communities on reducing risk through those basic prevention measures we've been promoting since the first part of the year. Now, the numbers over the last few days do suggest that cases are starting to fall back now, and we'd normally expect it to take at least a couple of weeks before additional restrictions started to bite. So there are some early signs that they are starting to take effect. I think the important thing to remember, though, is that the impact on our hospitals of this increase in cases may well lag behind what we're seeing in the community by a couple of weeks. So we should expect pressure on our NHS services to worsen in the short term, and that may mean that difficult decisions need to be made about what services can continue as normal and what services may need to temporarily be cut back. And regrettably, we are going to see a further increase in deaths.
Yeah, okay. Thanks for that, Liz. Daljit, question from Ian from Morpeth, and actually some others around this one as well. Why did we join forces with the other 6 local authorities when their case rates were much higher than ours? And given this, will we all be lumped together again after the 2nd of December? And will we use this collective approach when negotiating with central government in the next week or so?
Thank you for your question, Ian. The LA7, which is Northumberland County Council plus the other local authorities, Newcastle, Gateshead, North Tyneside, South Tyneside, Sunderland and County Durham. We took the decision to approach the government directly, seeking additional local restrictions as a united front, which we did in September. We received a great deal of advice from our public health experts first and foremost, and then had discussions as a group of councils before deciding to join up together as 7 local authorities. One of the main reasons was due to travel between the county and other parts of our region. Mostly this is for work, school and leisure. And as a county of Northumberland, we needed to be in the same zone as the other regional authorities. Looking forward, the decisions about which tier we will be in will be made directly by government. But I can assure you that the health and well-being for the whole of our county as Northumberland is our top priority. And we will always abide by what is considered to be best and safest for our county, and that's the option we will follow. Thank you.
Yeah, thanks, Daljit. Perhaps if you could take the next one as well, which is Pam from Hadston says, can we do more to stop people making non-essential trips in the county, as some of our country parks have been extremely busy over recent weekends?
Okay, thank you for your question, Pam. And I think it's one that a number of people have asked. The current national guidance asks us very clearly to stay at home as much as we can, unless obviously we have to leave for very particular reasons and for limited purposes such as work, education, exercise, or for essential supplies. We would ask that when taking exercise, we all try and stay close to home. Recently, we have seen some large groups on our beaches, at beauty spots and in our town centres. That's particularly been over the last couple of weekends, which actually risks the virus spreading at a faster rate, especially when people are not socially distancing. We know how beautiful and popular our country parks are, and the benefits of places like this can bring for people's mental health and for people to enjoy themselves. But we do need to take care. And if somewhere is really busy, if you go somewhere and it's really busy, please think about going somewhere else. As we all know, this is a virus that is spread from person to person through close contact. So let's try and keep the close contacts and the number of contacts to the absolute minimum and keep a safe distance from other people. It's really important to wear a face covering when required. That not only protects other people if you do have the virus and you haven't realised it. We also just need to remember the basics, washing our hands regularly, thinking about anything we touch, particularly outside of our home, could have been touched by someone with the infection who has left traces of the virus, and that can then be picked up.
Yeah.
Thank you.
Okay, thanks, Daljit. Liz, next question for you. This is actually a theme around enforcement that's come from a few people. Roger from Gilsland is among those asking, what are we doing to tackle those who flout the rules? Liz.
Thank you. I think since the start of the pandemic, we've always really wanted to take people with us, because for us to beat this virus, we've got to have a collective response, and community participation is absolutely essential. We know if people don't believe what they're being asked to do is right or necessary, that there's every chance they won't follow the rules and guidance put in place. I think we're really fortunate that the vast majority, whether that's residents, visitors, businesses, they've done everything that they can to protect themselves, their families and their customers. And I think our focus has always been on engagement and education. So working with our partners and explaining why measures are in place and what precautions people need to take. And really for businesses, that should be a win-win, because putting good control measures in place protects staff, it protects customers, and it may make people feel more confident about using those businesses. And that's really good for business. And it's good in terms of reducing the risk of outbreaks and reducing the risk of spreading the virus. But unfortunately, you know, there are a small minority of businesses that have just been unable to do what was being asked of them. And, you know, we have closed 4 pubs during the period that we were in those tier 2 restrictions. That wasn't something that we took lightly, and each time we worked really closely with the police to ensure that the evidence was there of clear breaches. I think primarily though, we've been working on helping businesses to trade safely, whether that's through visits to their premises, supporting their efforts to continue to trade with outdoor seating areas, all the work we've done to make our town centres safer places to shop through road closures, the extra signage we've put in place, or one-way systems for shoppers. I think we'd much rather advise, educate and encourage than resort to enforcement.
Yeah, thanks, Liz. So another key theme has been around what can we do to help businesses. Heidi from Rothbury and Mark from Berwick have asked about support for businesses at this time. What can we do, Daljit, to help business people?
Thank you both to Mark and Heidi. We know this year has been incredibly difficult for our local businesses, some of whom really were only just starting to get back on their feet and are now facing further uncertainty. Since day one, we've looked to support the business community, and we've paid out now circa £115 million in COVID grants to businesses in Northumberland. And as a county, we're in the top 4 councils in the country in getting these paid out as quickly as possible. We have lobbied hard to get additional support for businesses, particularly in some of our key business areas such as tourism and the hospitality sector. We know that there are still businesses out there though that have been not able to seek some of the grants. So we are asking government to look at these areas again. But we also know that unfortunately, some have still not been able to claim anything. I think through the extended furlough scheme, the self-employed income support scheme, and things like mortgage holidays, all of these things have helped, but we're very aware that these can only stretch so far. Just this week, businesses in the county who have been legally required to close as a result of the latest national lockdown restrictions can now apply for an additional support grant from the council. This was launched by us last Friday. Businesses who can apply include non-essential retail, leisure, personal care, sports facilities and our hospitality businesses. And if you would like to look at the full list, that's available on the County Council website in our coronavirus hub. For those businesses, because people will ask, there'll be some businesses that don't meet that criteria for a payment. We are currently looking at further grant schemes, and these are due to be announced in coming days. We'll also publicise these as soon as we can on the website. I would just like to reassure you that the team here in the council are working round the clock to make these funds available and to provide any support to businesses that we can.
Good, thank you, Daljeet. Peter from Seaton Sluice has raised the issue of gym closures. He asked, when are they likely to reopen? Daljeet, could you take that one?
Yeah, that's fine. Thank you for the question, Peter. We really appreciate it's a difficult time for everyone, and for many, exercise is a very important part of their life, if not for physical reasons, but also for mental health reasons. We, of course, are very disappointed to close our active Northumberland facilities. Obviously that's part of the national arrangements, but we do believe it's really important to support our local residents during this time. Well, we appreciate it's not quite the same as a trip to the gym. We do have online a bank of exercise classes that Active Northumberland on their YouTube channel have set up. Some of our instructors are delivering a mix of live classes suitable for all abilities, including those members who are currently attending our exercise on referral programme. Unfortunately, it's not yet clear when our gyms will reopen, but really I would just like to personally thank everyone for the support and the lovely feedback they've given to Active Northumberland, our team who works in the leisure area. And I know the team are looking forward to opening their doors again to the centres as soon as possible, and hopefully in the very near future. We are, of course, across our great county, very lucky to have such amazing outdoor spaces on our doorsteps though. So I'd encourage those who can to make the most of those for their daily exercise.
Good, thank you, which is much nicer than an exercise bike, usually. Thank you for that. John in Bedlington, he's asked us about the vaccine, and we know that actually many of you want to know whether it's safe and when it might be ready. Liz.
Thank you. So I think that's a really good question, because the COVID-19 vaccine is really topical at the moment. And I think the news that COVID-19 vaccines may become available in the next few months is really encouraging. But until the trials have been completed and all the data has been analysed, we won't really know what the impact of any of these vaccines might be. And it may be some time before we understand whether the vaccines interrupt transmission or whether they reduce hospital admissions or even deaths, because those outcomes won't necessarily be what the clinical trials are looking at. And of course, we've got to wait until any vaccine has been approved through the licensing process, because that is what provides us with assurance that they're safe and effective. And generally vaccines do have a really good safety record. It's then up to the NHS and other partners to plan how this new vaccination programme is going to be delivered. And I don't think any one of us should underestimate the magnitude of the task. It's going to be a real logistical challenge, but I think what I can do is assure you that everybody is absolutely committed to ensure that we get this vaccination programme up and running for our highest priority residents at the earliest opportunity. I think we also need to remember, though, that the vaccine isn't going to be a silver bullet. It's an additional and probably very important weapon in our arsenal, but we'll still need to do those basic things. So keeping your distance and reducing social contacts, hand washing, using face coverings and self-isolating and getting ourselves tested if we recognise we've got symptoms, or just self-isolating if we're identified as a close contact of a case. It's only by all of us reducing our personal risk that we can reduce the risk for those most vulnerable residents in our communities.
Yeah. Okay, thank you. The sort of final question would be around what's going to happen next. And a lot of people are asking what happens when the current restrictions end on the 2nd of December? What do we think is going to happen then? What might be the best thing that could happen then? And whether lockdown, might be extended. And I think we're all probably thinking about Christmas more than anything else. But Liz, what do you think? What do you think is going to happen come December the 2nd?
Well, I think that's a sort of $1 million question, isn't it? I think the bottom line is that actually none of us know for sure what's going to happen. I think we're being advised that the government may take a whole region approach rather than a more nuanced local restrictions one. But, with 14 days to the end of lockdown on the 2nd of December, as the figures stand, it's quite possible that we are going to go into that very high tier of interventions. And I'm just going to bring up a slide to show you what's been going on in Liverpool, because what you can see from this slide is that Liverpool had a huge number of cases on a daily basis, so in excess of 600 cases. But you can see that those cases have really rapidly dropped off, and that drop off coincides with the putting in place of that very high tier level of restriction in the middle of October. So, if it works for Liverpool, it can work for us. In terms of Christmas, I think, we all want to spend time with our friends and family this Christmas, but it's really too early to say what the situation will look like. I think in all likelihood, we will be returning to that 3-tier system at the beginning of December, and how long we spend in the tier we're placed in really depends on how well we can control those case numbers. So, I can't reiterate enough, it is in all of our interest to continue to adopt those protective behaviours that we know work and which reduce our risk of getting infection and passing on infection. And I think our role is to continue to engage with all of our communities to help them to make conscious decisions and to take positive action to keep themselves and others safe, and ultimately to save lives.
Thank you, Liz. Thank you, Daljit. This takes us almost to the end of the broadcast. I would just say that the council will continue to do all it can to help. So please look at the website, keep in touch with us, and if we can help, we will. we will support and protect those who need it most. And we will do all we can to help business thrive again. Meantime, the County Council will continue to do the frontline work that we do so well and continue on our ambitious programmes around schools, leisure centres and helping younger people get into training and employment. Hopefully things will be better soon. But in the meantime, as Liz and Daljit have said, we must continue to take those precautions we know that we have to do what we need to help prevent the further spread of the virus. So thank you to Liz and Daljit again, but most of all, thanks to you for the questions and for joining us this evening. Thank you.